Can I use my health insurance for functional medicine care? This is obviously a really important question that we get asked a lot because most of us, quite frankly, are used to using our health insurance to see the physician. And there are physicians out there who practice functional, integrative, holistic medicine who do accept insurance. And so that's wonderful. It's a wonderful option for many people. A lot of functional medicine physicians, however, do not accept insurance, but there are ways to actually make your insurance work for you if you are seeing a functional medicine doctor like those at Vital Health or other practices that don't accept health insurance. One thing to keep in mind is that many people have an HSA or an FSA account. That's a health spending account or flexible spending account that is pre-tax dollars that are set aside at the time you enroll into a high deductible health plan with your insurer, if that's your employer or whomever that happens to be. If you have a high deductible health plan, chances are you may have one of those types of accounts, and you can use HSA and FSA dollars for all aspects of functional medicine care, particularly with Vital Health, including seeing the physician, paying for labs, and paying for supplements. Those can all be put on those HSA and FSA accounts. So you can use those dollars and drive the type of healthcare with those dollars at your discretion, however you like. I love that part about HSA and FSA. The other thing to think about is that we at Vital Health and many functional health practices will supply you with something called a super bill. Super bill is a word that we use to describe some type of summary of the appointment that is appropriately insurance coded. There are these insurance codes that you have to use when you're talking to an insurance company that basically tells them what happened during the visit and why we saw you. And we can generate those super bills for you, and you could submit them for out-of-network charges that you probably have an out-of-network plan, so you can actually receive reimbursement for your care within Vital Health and other functional medicine practices. So a lot of people don't know that, and I think that's a nice thing to consider. Now, there are high deductible plans, so it doesn't always cover all of the care, but it might cover some, and it's worth pursuing, in our opinion. So if you think about what you'd like to accomplish and where your values are and what you have experienced in traditional medicine before, it might feel kind of weird paying out of pocket for healthcare, but at the same time, you might have experienced having your insurance company pick up a visit with a physician or a practice and having had no forward momentum, no value come out of that visit. So sometimes driving your own healthcare with your own dollars and your own spending is the best way to go to be able to get the results that you want for your care.